Urinary tract infections. The urinary tract infections are divided into the upper tract infections and the lower tract infections. In the upper tract infections, there we have pyelonephritis and perinephric abscess. In the lower tract infections, there is urethritis, prostatitis and cystitis. The UTIs or urinary tract infections are associated with multiplication of organisms in the urinary tract. Classification of urinary tract infections. It is classified into three types, that is asymptomatic, uncomplicated and complicated. Asymptomatic, there is presence of bacteriuria without symptoms. It is seen during pregnancy. Uncomplicated, females are more prone to develop as compared to males due to bacterial colonization in the bladder or the urethra, results in burning on urination, frequent urination without fever. Complicated, males are more prone to develop as compared to females. It is usually localized infection of the upper and lower urinary tract is seen. It involves renal parenchyma and it relapses after treatment. Etiology or cause of urinary tract infections include E. coli, Proteus, Klebsiella, Enterobacter, Pseudomonas, Neisseria gonorrhea. Acute urethral syndrome is where 1/3 of the females with dysuria, that is pain while urinating, have increased number of bacteria or completely sterile cultures. Collection and transport of urine specimen. The first one is midstream urine. The patient is advised to clean the area and to void the first part of urine into the toilet. Then to collect the midstream urine in the container and finally to void the last part into the toilet. The second one is catheter sample urine. The area over the catheter is first cleaned with alcohol after donning clean gloves. Then with the help of sterile syringe and needle, the urine sample is drawn and put into universal container. Suprapubic aspirate. This is collected from infants and older women with sterile syringe and needle by puncturing the suprapubic area. Early morning urine. If renal tuberculosis has to be investigated, then the first morning urine sample is collected. If upper urinary tract infection is suspected, the blood culture is also required. Transportation. The sample must be transported at room temperature within half an hour or refrigerated at 4 degrees Celsius for up to 4 hours. Investigations. The first one is dipstick test to detect nitrite, clean catch technique to obtain freshly voided midstream urine, gram staining, culture and sensitivity, cystoscopy in the suspected bladder lesions, and renal ultrasonography. Treatment. The fluid intake should be more than 2 liters per day. Administer antibiotics only if symptomatic. Alkalinization of urine. Regular emptying of bladder. Double micturition if reflux is present. In females, maintaining perineal hygiene. Emptying the bladder before and after sexual intercourse.